So hello, everyone. Welcome to session 3. And I think you have been joined for the first session of introduction of the process evaluation, and the second one about how to conduct the process evaluation with different frameworks, theories, and models. And today, the session is much more about the research design and also data collection for process evaluation. So the learning objectives are to understand the methods for data collection for process evaluation, and also how to use it to answer the process evaluation research questions. And today we will talk about mixed methods and also the qualitative and quantitative data that are going to be collected for the process evaluation. And after this, we will have a discussion Q&A about your own project. I hope you have time or capacity to read to do the pre-readings for today's session. So to better introduce the data collection for the process evaluation, I think probably most of you already have knowledge about the two types of data we usually collect in research. One is the quantitative data, which aims to understand the trends and also the relationships, usually reported by the numbers, percentage, or other stats metrics such as mean or median. And it's focused on the measurement, usually use a validated instrument, and also has to be precision and predictability. The other type of data usually doing in the research is the qualitative data, which is non-numerical focused. And usually the researcher, which is the interviewees is the instrument. And also compared to the statistical analysis, the analysis for the qualitative data would be much more thematic approach. And it's because we are collect data from the people, so it might be much more subjective. However, in the process evaluation, we're not stick to only one of the data type we have. Usually we will use a mixed methods research approach, which means we're going to collect both quantitative and also qualitative data to support and help us to better understand the implementation of the intervention. So when should we use the mixed methods design? First of all, it can help us to triangulation of the findings and use both of the data type, the quantitative, the numbers, and also the quote and statements from the qualitative data to enhance the validity across the findings. And also it will help us to explain the confusing results, especially the numbers or like the risk ratios that is from the stats, to explain more from a human about who and how and why we reach that kind of outcomes. And also it helps for develop the design for the survey or interview questions, which I will talk us through about this approach in the later slides. And also the mixed methods research, it can also help us to explore the difference and also to make the findings more applicable and enrich. And also it can help us to learn more about just one topic. So for the mixed methods design, usually there have 3 different types design. And it's all about how can we integrate the quantitative and also qualitative data collection and analysis. The first one the mixed methods design is a convergent parallel design. As you can see from the figure, both of the quantitative and also the qualitative data, they are collected parallel at the same time. And then after data collected, the results will be compared in related. And also both of the findings will be interpreted to answer just one question. The second type of the mixed methods design is explanatory sequential design, because the aim of this design is trying to give an explain of the research question. So usually the quantitative data will be collected at the beginning. And once we got like the final results from like the numbers or from some like stats outcomes we have, then it will be followed up with the qualitative data, such as an interview or focus group discussion to explain the results from the qualitative data. And then we can interpret it, the findings, and then to determine why we have the quantitative results. And the last design for the mixed methods approach is exploratory sequential design. So it will be much more aims for explore from the qualitative findings we have. So as you can see, the qualitative data from the interviews will be collected first, and then which will build up to some survey or questionnaires, and then spread answer to better develop a kind of new, for example, instrument like a survey tool, and then to explore in a bigger sample. So usually the mixed methods design can be embedded into the intervention research or program, because it can help both to explore the results from like a big quantitative trial, or it can help us to examine the process that is experienced by the participants, which can be a convergent design. And also it can help us to explain the results. For example, like a post-trial process evaluation. So usually in the mixed methods design, we integrate both of the data types from 3 different approaches, including the merging, which means we analyze the data from the both quantitative and also qualitative data, and then to assess whether the findings can be converged upon the other. For example, you can use a joint display to just answer one questions by both like the quote from the qualitative research and also the numbers from your quantitative data. Another integration approach is to connect. So that means you can connect both of the type of data, can connect one type of data to inform the other. For example, like we can use a survey to identify the eligible participants for the interviews to further understand one question more deeply. The third approach to integrate the mixed methods research design is to building. So that is much more like the explanatory analysis approach, which means you can use from one database to inform the other. Like as mentioned, the example before in the last slides, you can use the survey to develop questionnaires based on the quantitative, like your interview questions, and then to better get more answers and also to get like a percentage of the bigger participants and say what is the trends of this kind of question. So in terms of the data sources for the qualitative data collection, So usually in the process evaluation, we use this 4 types of quantitative data. First of all is the survey, which probably you're quite familiar with. It can be developed as from previous valid measurement tools, or it also can be developed from your interviews. And also we use some project data, for example, like operational data such as the recruitment speed or the cooperation from the sites to understand what is the context and also what is characteristics of the participants. And also sometimes we can use the monitoring chart or the case report forms that usually collected from the main programs to supplement the findings about the process and the implementation of the intervention. However, for qualitative data collection, usually it can be from multiple resources. It can be some kind of like field notes that is collected or administrated by the participant sites, or it can be observation, such as non-participant observation, which can be a third party to record or to help monitoring the intervention implementation. And also it can be much more general, such as semi-structured interviews or like focus group discussions or other type of discussions, such as nomotechnic group discussion, or you can also collect data from Delphi as well. So for the qualitative data, it can help us to better understand like what actually works and who have been involved and why that of the that has contributed to the intervention implementation. So after introduce the different types of the data and also what is the approach for us to collect the different types of data, I'm going to just briefly introduce some of the sampling methods for the qualitative data collection. I think some of you already had some knowledge about the sampling methods in the previous question. But usually in the process evaluation, when we collect the qualitative data, we usually use a purposive sampling because it can help us to ensure the relevance and also to make sure the participants are representative from the program population or from our study population. You can set up some of the criteria to help you to select the participants for the qualitative data collection. You can also use a snowball sampling, which much more based on the networks of your participants, and ask them to referring some individuals who have the similar characteristics to participant in the qualitative data collection. And most useful one would be a convenience sampling, which is depending on like who is available and who is convenient to be invited or to participate into the data collection. And this one is usually used for some pilot study or preliminary research. For the qualitative data collection, usually people will have question like, how many participants should we have for the interviews, and how many people we should get to, how many of the focus group discussion we should have to make sure we have enough data. But actually in qualitative data collection, it's not like the quantitative way using like sample size calculation or for the power calculation for the statistical analysis. For the qualitative data, it's much more about to reach the saturation, which means you have much more fruitful data and things coming out. And also it depends on the complexity of the research topic. If your research topic is simple, quite much quite simple one, probably an interview of 10 to 15 interview should be enough. But if your research topic is very complex and your intervention components involves a lot of components and also your stakeholders involves different characteristics, then you will have to consider to have more interviews to make sure you can reach the data saturation. I think in last session, we have some students ask about the difference between the Delphi and also of the nominal group techniques. So we added a slide regarding this just to help you to better understand the difference and how can we better choose the approach for the data collection. So basically, the Delphi is a much more structured communication to asking the experts and to give their statements through through multiple rounds. The pros and cons has been here, but it will, because it involves multiple rounds, so it will be more time consuming and probably much more costly compared to the other approach. However, for the nominal group techniques, it's about also a decision-making process where it has, but ask the group members to rank their ideas before discuss to reach a consensus. Compared to the Delphi methods, the nominal group technique, it's usually have a limited participants because it's within a small group. And also the answers probably will be influenced by dynamic group characteristics. And it's not much suitable for some complex program because it's really held within one session and in a relatively short time. So when you really need to get some expert insights or to answer some complex questions, Delphi will be much more preferable. But if you need to answer some questions that is very quick with a very short timeline and to understand what is the priority, then the nominal group techniques would be much more helpful. After this, after my presentation, I will introduce another invite speaker to talk more about how to use the Delphi methods at the end of the presentation. So now I would like to use the Interact 3 study as a case study to talk through like how did we apply the mixed methods approach for the process evaluation in Interact 3. So in Interact 3, we used a convergent parallel design, which means we collected both of the qualitative and also the quantitative data at the same time to answer the same questions about how was the care bundle, which is the intervention, has been implemented, and whether it's being accepted and appropriate. So we collect data during the trial processes. As you can see, the data collection has across multiple time points that include the interviews with both of the clinicians and also the patients, which is being collected at the early phase of the trial to understand what is the barrier and also how can we better improve the implementation. We also collected non-participant observations in the purposive sample site during the monitoring visit. So we have the CRA, which is operation team member, to observe whether the sites have delivered the care bundle and how was the process looking at this local site and how was the intervention incorporated in their workflow. We also conducted a focus group discussion, both with the principal investigators from the purposive sample site to understand whether there is some context or organizational barriers to implement the intervention. And also from the operational side, we conduct the focus group discussion with the CRAs and the project manager, which aims to early understand how can we better improve the implementation from like the operational and also communication process. For the quantitative data, we collected through some surveys and also questionnaires and also some monitoring records and also the case report forms at individual level from the patient level to understand how was the intervention delivered. And also in the survey, we asked more about like the values and also the acceptance of the intervention by the clinicians and nurses. And this has been done throughout the whole study phase. And this is, we used MRC frameworks to better summarize, like, how did we collect the data for different type of implementation outcomes we're looking at, and also how is the outcomes being measured and how it then can be explained through. So as you can say, we collected from the survey for the fidelity and also for the dose about the intervention implementation, but more specifically to understand the appropriateness and acceptability through the qualitative data research, and to understand the adoption and also the sustainability, like whether the care bundle was integrated and incorporated into the routine practice using a non-participant observation, and also from the routine monitoring data or field notes. So in Interact 3, we used a purposive sampling methods to sample the sites for the qualitative data collection. And we set by the different criteria, include the region of the participation, such as the country, and also whether the hospital is in urban area or a semi-urban or rural area. And also we consider the different levels of the hospitals, whether it's a tertiary hospital or like a secondary or primary health care hospital. And also because we have involved different departments in the Interact 3 trial, so we purposely sampled like the neurological department or neurosurgery department or other general wards to participate in the interviews. And also we consider the performance for each of the sites as well, whether they are cooperated and how, and also according to the recruitment speed to better measure like which site is representative to the whole cohort of the participant site. And we did the process evaluation and data collection stratified by countries, because as you know from the previous sessions about the case study, we conducted the process evaluation in China as a vanguard phase, and also because we have nearly 80% of the participants were from China. So we conducted like 26 interviews with 9 sites as a representative in China. And outside of China, we also conducted 27 interviews from across 11 sites outside of the China. And finally, we reached the goal for the data saturation. And also for the focus group discussion, as mentioned before, we conducted according to the regions and the country. And we have organized the discussion with the national leaders and also the site PIs from each country. And during the interview, data collection, we have some reflections to better help us to better organize the interviews and also for the qualitative data collection. So we found that it's better to schedule the interview as early as possible, because usually the clinicians and also the nurses are very busy, and also it was difficult to find like a common time for us because we're doing it through different countries. So it will be a lot of like difference in the time zones. So for the interview, it's better to schedule as early as possible, and also to send the information consent form at the early stage when you give the invitation. And also when doing the interviews, it will be much more like a communication rather than ask questions. So we usually develop an interview guide, but it should be better pilot before you actually roll out the interview guide, and just make sure like the interview should be more like a general communication, and it will be good for the interviewer to get familiar with the interview guide questions and to do the probing of each questions to get more in depth from the answers. And also we found that it is better to have some interview notes while doing the interviews to better help summarize and also improve the next interview. And also it's also recommend to have a regular discussion with study team about your interview notes, which can better reflect the timely to help you timely optimize the intervention implementation. So this is all my reflection and case study based on the mixed methods research and also data collection from Interact 3. Now I'm just hand over to Ignacia. She did a Delphi study based in Interact 3 in Latin American. I think this will provide more in-depth information about the data collection for the qualitative data. So just a brief introduction of Ignacia. She is a general practitioner from Chile, and she is working also a master student at the George Institute. And her research area include both mixed methods research and also addressing the implementation barriers in Latin America. And we'll also investigate the inequities among the stroke patients' care in Chile. So now I'm just hand over to you, Ignacia, and I will stop sharing. Can you share your slides?
Yeah, thank you for the presentation. I'll share my screen and my slides. Can you see them?
Yes.
Yes, we can.
Yes? Okay. So today I'm just gonna do a brief introduction about the Delphi methodology, and then I'm gonna talk about my work. So in the Delphi methodology, what we want is to generate or summarize a consensus about a problem within a group of experts. And the Delphi methodology is quite flexible, it's not as rigid, but it has 4 important features. First is anonymity, and this is a very good quality of the Delphi study because it prevents group conformity, which is, for example, if we all express our opinion in a group, some of us, in order to have our harmony in the group, will try to consent with that opinion. The other feature is iteration, so asking the same thing over and over, control feedback, and group response. And in healthcare has been used for a lot of things. It has been used more and more to evaluate current knowledge, resolving controversy, guidelines, tools, and recommendations. So just before we start to see each step of the Delphi, I just wanted to make a quick assessment of how a Delphi will be performed. So we'll first need to create our first questionnaire or first survey, and we have to select the panel of experts. When we create this first survey, the Delphi process can begin. So in the first survey, the first round, you will send a questionnaire to the panelists. And in the second round, you will send the same questions, but with feedback. And you will ask them to state their agreement with that safe statement again. And round 3 is very similar to round 2, and then you will collect all your data. So how do we choose the problem, or how do we create the first instrument? The important thing is that it must be stated before we begin the Delphi round. And we can do various things. For example, if you try to define like the definition of a disease, it will be good to do a systematic literature search to see how others have defined that disease previously. But you can also do a group discussions among a steering group, or for example, if you try to see recommendations to implement some intervention, it will be good to the panel of experts that you already choose, have open-ended discussions, and then create your instrument. But how do we select the panel? Well, there is no standard criteria, and everything depends on what is your objective. If your objective is you need a diverse panel with broader perspective, for example, recommendations for rehabilitation services, you probably will need people with lived experience, physiotherapists, clinicians, and so on. But if you have a particular study objective, for example, just the definition of this disease, maybe your panel will be more homogeneous. And how do you define the expertise of a panel? Well, this is the most difficult part of the Delphi, but most of the Delphi will define a predefined criteria. Could be number of publications, numbers of years experience, or you can also, for example, in some Delphis, you can actually ask the participants if they consider themselves an expert. Sample size. Well, there is no a standard sample size. You can go from 10 to 1,000. It will depend on the complexity of your problem, how diverse your panel is, and how many resources you have. But generally, Delphis go around 30 to 50. And I will say 30 to 40 is more the range in which Delphis are in. And how do you proceed with the rounds? Well, in the first round, you already created your survey. So you have statements, and panelists will need to provide their level of agreement. For example, this is just an example, chocolate ice cream is delicious, and you will ask the panelists to rate that according to their level of agreement. In the second round, that panelists will receive the same statement or a modified statement with the percentage of agreement of the group, and also some feedback from the last round. For example, you can put comments, etc. The final round, it will be very similar to round 2, and you will end up in round 3. How do we define consensus? Well, the most common thing is to just use the percentage of agreement based on a predefined cutoff. And that predefined cutoff can go for 50% to 97%. And agreement is basically just saying, well, my cutoff is, for example, 60%. I will say that if 60% of my panelists are between agreeing and strongly agree, then there is a consensus that this statement is true. And how many rounds Delphis has? Well, conventionally could go from 3 to 4. Many of Delphis will predefine the rounds, but there is not a consensus of how many rounds you should go. And this is my case study. So what I wanted to do is the recommendations for implemented the Interact 3 in Latin America. I think you already know about a little bit of what Interact 3 is. So I'm just gonna go into the methods. So as Menglu said, they did a process evaluation. So I already had that data. So what I was do a comprehensive review of all the qualitative data of the process evaluation and created my first survey draft. If I didn't have that information, I would probably do a first round with open questions to the participants. But since I already had all that information, I just proceed with doing the first survey. My first survey had 6 domains and 43 statements. And how I did select the panel, I did a pre-specified criteria. And my criteria was healthcare professionals with a minimum of 5 years of experience. They needed to have 1 year of experience in a public health facility. and they needed to be currently involved in the care of ICH patients. And my sampling method was purposive sampling method. Delphi round. So this is how a Delphi round 1 will look. You have your statement, you have your Likert scale that can go from strongly agree to strongly disagree. I didn't put neutral because I wanted to force agreement or disagreement. And there is a box to provide comments. So for example, in this statement is the distribution of protocols for the management of patients with ICH should be in the form of infographics with attractive colors and easy reading. And you have 3 scenarios. First, your statement achieved the predefined consensus agreement. That in my case was 75%. And if it achieved that level of agreement, it will go to the final list of recommendations. If it failed to achieve that agreement, I will move it to the next round, but I will modify the statement according to the comments that the participants or panelists gave. And also there's sometimes panelists will provide new recommendations that will emerge from these rounds, so you can move them to the second round. So in the second round, it will look something like this. You will have your old statement. You will have the modified part according to the feedback from the previous round. And in this case was to ensure that the infographics were strategically placed in areas where ICH patients receive care. You will have the response in round 1, this is the control feedback. And you will have anonymized comments from the participants. For example, it should have attractive colors, but if it doesn't reach the right personnel, it wouldn't be worthwhile. Your Likert scale and your comments. And just as in round 1, you will have 3 options to move to round 3. Round 3 works similar to round 2, but in my case, and what many Delphis do, is they incorporate a ranking section. And instead of just stacking the statements, I wanted to granulate that importance of the statement. So I did another Likert scale from 1 to 9, 1 being most important and 9 being less important. So in my Delphi, I recruited 32 panelists from 14 countries. And yes, this is my round. So in round 1, I started with 43 statements, 12 new statements emerged throughout the rounds. And at the end, I'd have 55 statements. I had a 100% retention rate, but that is because there was a monetary incentive to completion of all the rounds, because it is a bit time consuming for the panelists, because they need to go through all these statements who were 43, and then provide their comments and so on. So this is just to show, this is the top half recommendation in each domain for the implementation of the Interact 3, but beyond that, just presenting them as how they were ranked. We also did a thematic analysis and to see what was the most important themes that arise from the Delphi. In my case was insurance of minimal resources, resource-aligned protocols, collaborative approach, and continuous training. And that was my Delphi study.